I'm Debbie Stadtler, editor-in-chief of Provider Magazine, and today I'm here with Samantha Vosloo, value-based care director at PointClickCare. Welcome. Thanks for being with us.
My pleasure. Thank you.
The healthcare landscape is changing and quickly. With the shift from fee-for-service to value-based care, providers are being challenged to rethink not just how they get paid, but how they provide care. It's more than just swapping out contracts, it's about reimagining care coordination, managing risk differently, and redefining what success really looks like. In making the leap from fee-for-service to value-based care, this is a major shift. Samantha, what mindset and behavior changes do providers need to adopt to make that transition stick and then to go ahead and thrive in that new environment?
Absolutely. That's a great question. So, this is a fundamental shift, not just in how we get paid, but how we think about care delivery. In a fee for service model, success is often measured by volume. So, how many visits, how many procedures, how many minutes of therapy. But in value based care, success is defined by outcomes. So, how well are we managing chronic conditions? How well are we doing at preventing hospitalizations and improving quality of life? So I'm a nursing home administrator by background, and I got to see firsthand how this shift plays out on the ground. We had to move from reactive care, so thinking about spending our times responding to falls or infections or readmissions, to proactive person-centered wellness. So that meant investing in my interdisciplinary team and their ability to collaborate, using data to identify risk, and then empowering our care teams to identify and act on those changes. And so behaviorally, it's about working at the top of your license and trusting your team. So for example, we had a CNA who noticed that a resident was more withdrawn and eating less. And because we had a culture of proactive care, she flagged it early, and we were able to intervene before it became a hospitalization. Now, this is a simplified example, but that's the kind of mindset shift that we need, where every team member sees themselves as a part of the care quality equation. And it's not just skilled nursing centers either. It's practice groups, senior living communities, and risk bearing entities. We all need to align around this shared vision. We have to enhance resident outcomes, operational efficiency, and financial sustainability. And this all starts with that mindset that embraces collaboration, data driven decision making, and person centered care. And so when we do that, we're not just going to survive this shift in the marketplace, we'll have an ability to thrive in it.
I love that. I think that's a really important point about being proactive and really being able to make those interventions before it becomes a worse situation. Well, as financial risk models like shared savings and downside risk become more common, how can providers strike that right balance between managing costs, but also keeping patient care a top priority?
Yeah, I think it's really important for providers to remember that this is not an either or an or, it's a both. And the key is visibility. We have to manage cost and maintain quality and understand that that's not a trade off. It's about creating alignment between clinical excellence and financial sustainability. So, in my role, I get to talk to a lot of senior care operators. And when I speak with them about engaging in value based models of care, they have questions. So, what does this mean about my ability to provide care for my residents? Does this mean that I need to cut corners? But in fact, it's the opposite. By focusing, as you said, on those early interventions, reducing unnecessary hospital transfers, and improving the overall outcome of the resident population, providers are able to achieve both improved outcomes, and we know more and more we're getting paid on our outcomes, but also reducing cost. And so here's a great example of that. I work with a provider who entered into a program where they receive a monthly payment from the health plan in lieu of any fee for service Part B billing. And I know a lot of providers, when they hear that, they get a little spooked, but stick with me here. The provider used that predictable revenue to actually staff a occupational therapy assistant or a CODA. And this CODA's sole focus was the taking care or overseeing the residents that were aligned under that plan. And so this individual did things like helping with get ups, with ADLs, and all through all this work, they were monitoring the residents for changes and reporting those changes to the broader interdisciplinary team and the practice group. And so by leveraging this information and laying on top predictive analytics and insights, this CODA was able to work with the IDT and the practice group to implement interventions at the first indication of changing condition. And so this organization was actually able to improve their hospitalization rate on this population by 23% in 6 months. That's the kind of impact that's possible when you have the right tools and the right incentives that are aligned across the continuum of care. And all of this isn't really possible by chasing charts, right? So technology has to bear the burden of consolidating data points and surfacing risk indicators. So having an integrated solution needs to facilitate efficient communication and data exchange across care teams. So when the EHR is able to surface real-time insights, providers can act quickly and confidently. And so this improves our care delivery. And more importantly, it allows our teams to spend more time with the residents, which also is going to enhance satisfaction and outcomes. You asked a question about cost. And so these principles not only enable better care, which of course is our first and primary objective, but also enable better reimbursement in a value-based care world. Providers are able to maximize their reimbursement and actually share in the savings that they've created by providing proactive care. That's enabled through strategic partnerships with risk-bearing entities. And what's beautiful about that is when we align incentives and share in accountability, everybody wins.
I love that you mentioned that it's not either or. It's not either reducing costs or prioritizing patient care. It's both, which in an ideal world is really where we want to be with this all together. Now, you mentioned technology and data to improve both the bottom line and patient outcomes. What metrics should providers be paying attention to? And then where does technology fit into helping them track, analyze, and act on that data?
Yeah. Metrics are at the heartbeat of value-based care. They tell us what we're doing well, where we're falling short, and where we need to place our focus. Some of the most critical ones include rehospitalization rates, change in resident condition, and resident satisfaction. It's important to remember that these are not just regulatory checkboxes, they're actually indicators of how well we're delivering care. And so, in my experience, one of the most powerful tools that I had at my disposal was a dashboard that showed real time hospitalization risk. What was important about this is that our hospital partner and our practice group that rounded in my building had the same tools. And what it showed was residents that were at high risk, rising risk, and then also the clinical factors that were driving the decline. And so by having this shared data at our fingertips, we were able to communicate efficiently, collaborate on the best interventions for each resident, and then improve their outcomes more effectively. And so a great example of this, I'll just note here that often when I start talking about shared data across the continuum, people get a little spooked. I don't want to, expose myself to risk or liability, but really the world that we're moving to, having this shared insight really allows us to do better. And so I'll give you guys an example. I had a resident newly admitted to my building with CHF. And this resident was new to us. We didn't know him. He'd never been with us before. And so we didn't identify that his failure to participate in therapy and walk to the dining room was a change for him. It was actually the hospital care navigator that called us and noted that this was a changing condition. And this care navigator actually identified that the hospital had left off a medication off the medication reconciliation list. And so we were able to restart that medication. The resident's condition improved, and we prevented what would have almost certainly been a rehospitalization. That's the power of sharing. And so, when I'm talking to providers who maybe are a little hesitant, by sharing our data and being good partners across the healthcare ecosystem, these are the type of outcomes that we're able to impact. It's also important to note that CMS has made an effort to align incentives across the continuum of care. So we see this when we examine STAR and HEDIS measures versus, for example, state-based quality incentive payments based on to skilled nursing centers on your Medicaid rate. It's critical for your broader care teams to understand how their actions impact these measures and metrics across the continuum. It's important that this type of insight is provided within their normal workflows of the team, and it's as close to real time as possible. This is not just about compliance, although it does help in that area. It's also about empowerment. When our frontline staff can see how well their work is doing to impact outcomes, they're more engaged. And when administrators can benchmark performance, they can lead more effectively. And finally, when risk-bearing entities can access this type of timely data, they can support care coordination, which ultimately drives shared savings. And technology is what makes that type of insight possible. We can't really wait for measures that are reported by CMS, for example. They are so far behind that they're not really effective in supporting operational decision making. Having timely data is huge. It means that providers can track metrics in real time, streamline their documentation, and then implement actual interventions that are going to influence that outcome. And so, whether you're a SNF or a senior living community or you're operating a physician's practice, the ability to track, analyze, and act on data is what turns good care into great care and great care into sustainable value.
I think that's a great example that you gave about coordinating the data and communication across the care continuum. It's not really only about internal coordination and metrics and data, but really organizations outside of your own and coordinating that whole pathway that the resident may be on. I think that's just such important to remember, that it's really more than just the senior living or SNF. It's really a lot of other pieces. Well, how can senior care organizations identify ways to improve clinical, operational, and financial performance in a value-based care setting?
It's exactly what you just noted. It starts with visibility. You cannot improve what you can't see. And that's why tools that provide insights and standardized evidence-based clinical documentation are so powerful. They help providers surface these opportunities across their clinical, operational, and financial domains. Another key consideration to this is how to facilitate effective communication and data exchanges across care teams. You nailed it. If you were to close your eyes and think about how many operators, providers, entities interact with my residents on a daily basis, you're going to find that our worlds are maybe more connected than they ever have been before. So this type of data sharing is critical. Whether you're coordinating with a primary care practice or a hospital discharge planner or even a pharmacy partner, that seamless communication ensures that everyone's aligned on goals and then also accountable for the actions. I think a final and really important piece to this puzzle is the role of strategic partnerships. When skilled nursing centers and senior living communities or practice groups partner with risk-bearing entities, they gain access to resources, data, and incentives that accelerate improvement. So, for example, a partnership with an ACO that has a shared pain into resident prediction condition and then their rising indicators of risk, this can expedite bringing interventions to the bedside and improving overall outcomes through care coordination and support. Like you said, it's not just about internal performance. Strategic partnership, especially with the risk-bearing entities, can unlock new revenue streams and create shared accountability for outcomes. And also, from a leadership perspective, it's about creating a culture of accountability and continuous improvement. Because when our teams are empowered with the right tools and consolidating around shared goals, they can deliver better clinical care at a reduced cost. And really, that's the future of value-based care. It's smarter, more connected, and more sustainable.
Well, I don't think you could have said it any better. Smarter, more connected, more sustainable. That is absolutely the direction we need to go. Well, thank you for taking the time to be with us today, Samantha. I appreciate it.
Absolutely, it was my pleasure.
Thank you.